Alright, hello. So this is the video for question 11, 12, 13 for case A of module 3. Application abilities. So with my patient, he has De Quervain's tenosynovitis. And so the first question is asking what manual technique would be appropriate for this patient. So we could do some cross-friction massage over that scar and those tendons. This will decrease that inflammation, prevent scarring, and kind of get those fibers realigned. So we're going to note his scar that he has from his surgery, as well as kind of the sore spots where that tendon sheath is. We're just going to perform cross-friction massage. So for that, you go perpendicular to the tendon, and notice how with my finger I am applying force in one direction and then lifting off, going back. So this is to decrease the pressure and kind of the discomfort that this technique can inflict on the patients. So you can do that. You got that. Next question is asking what exercises would you prescribe and why. So we can do some passive and active range of motion to start out, just to again prevent any scarring, get blood flow going to the area, and to maintain range of motion. So I'll have my patient perform some passive flexion and extension. There's that. And you can do thumb extension and flexion as well, passive. And then flexion is then bringing it into the thumb, adduction and abduction. And then we can do those all active as well, which would just be the same motions, just him doing all the work. And then those can be followed by strengthening exercises. So we'll start with isometrics. So we can have him just go into his own thumb for flexion, and then he can resist his own hand for extension. So the actual joint, there's no movement, it's just the muscles pushing against each other. We can do that for all of those areas. And then after that we'll get into eccentrics. So you know, against gravity, having him slowly lower down in other ways. So yep, there's eccentric wrist flexion, and yeah, you guys get the point. And finally, what therapeutic devices would you recommend for this patient and why? So I would recommend a thumb spica splint. We're going to start out, well, usually there's an actual cast for it, but we can find one, so I'm going to show you guys how to tape it. So we're going to start out by wrapping his wrist nice and snug. Alright, so now that we have this, we're going to get our half strips that we have here, making sure to stay out of that web space, and we're going to wrap them around the thumb and that first MCP joint. So here, starting on the inside, staying out of that web space, and pulling that thumb back into extension. Each time going around, working your way a little more up that thumb, making sure to keep that PIP free. And we'll go around one more time. Finally, we're going to make sure all these half pieces stay in place by making one more wrap around the wrist. Alright, there we have our finished product. Again, that PIP is free. Thumb is stuck in abduction, abduction, and extension. Make sure to stay out of that web space to prevent any skin damage. And he'll wear this post-surgically the first 2 to 3 weeks, and then we would apply those exercises and range of motion stuff that I explained previously. Thank you.